Suppose you were in need of health care, but the nearest clinic was located 60 miles away. If you needed prenatal care and there was none to be found in your community, what in the world would you do? And what if you were a migrant worker with a serious toothache, but you had never been in one town long enough to acquire a regular dentist? Where could you go?
ORHP has had a real impact in organizing rural people for better care. The problems of rural health care are really just the result of a terribly obsolete national health care system. It's all fragmented. We don't have good ways of coordinating and organizing care. It's astronomically expensive to run, and rural bears the brunt of a lot of those problems.
I actually took the opportunity to go back and read board minutes from around 20 years ago, and a lot of familiar challenges, reimbursement for health care, concerns about regulations, looking for more money, but a lot of things are different too. The Critical Access Hospital program has helped a lot of rural hospitals not worry so much about survival. It's given them the opportunity to think and work more for higher quality care and to work with their community to improve health status.
There wasn't a whole lot of federal, rural-specific activity going on before the ORHP. Usually a rural community would just try to pull itself together and do the best it could to organize a hospital and a clinic. There wasn't a whole lot of funding for any of those kinds of things.
Well, we were created to be a voice for rural within the Department of Health and Human Services, specifically in how they make regulations and policies to make sure that the needs of rural America were taken into account. And that specifically came about in the 1980s with rural hospitals. A large number of them closed due to a regulatory change. And because of that, they said, well, we need to make sure that at least the rural voice is heard.
Positive things, though, that happen to rural health over the last 20 years is that now there are organized ways to make rural needs known and to work on them. And most of those funnel back to ORHP one way or another.
When the office was started 20 years ago, there was only a handful of state offices of rural health around the country, and none of them were receiving federal funding. Now we have and fund 50 state offices of rural health. Through those state offices of rural health, and I have their partnerships and collaborations with hospital associations and other provider organizations, they are better equipped to work with the issues.
Collaboration in rural communities is key to getting health care, transportation, drugs out to the people who really need it, especially in frontier areas.
Communities have to work with communities. Together, rural communities need to work with their universities, their voc tech systems, their government. We can solve these problems, but we need to work on it and we need to focus.
Collaboration doesn't necessarily mean it's just the healthcare providers like the pediatrician and the OBGYN and the podiatrist down the street talking to each other. It's everybody in the community talking.
We have a grant dissemination function here. That's one arm of the ORHP, and I work specifically with the community-based team. We serve as brokers of information, really. We provide information to individuals to apply for grant programs, specifically rural organizations.
Probably the biggest health challenge facing our county is access to health care, particularly access to dental care. If you look at the ratios, we have enough dentists to serve the number of people in our county, but the problem is they're not seeing the poor people. There are no dentists currently in our county that will accept new Medicaid patients.
Absolutely, health care is a problem. So many students who don't have health insurance and therefore don't receive adequate health care, especially when it comes to things like dental care that unfortunately some families see as a luxury.
So when we found out about the grant opportunity, we said, okay, what's the most important things? The mobile dental clinic that we implemented called Healthy Teeth, Healthy Kids, and that's where we go directly to the schools. We picked out the neediest schools in the county and provide comprehensive dental care to these kids. They can get x-rays, fillings, extractions, varnishes, everything that they need right there at their school.
I was so excited to have the mobile dental clinic come to Jefferson School because I knew how much it was needed that I woke up that morning. I'm an early riser anyway, but I was up even earlier and just butterflies in my stomach and couldn't wait to get to school, couldn't wait to see those kids getting that health care. I was just bouncing around all day, excited that they were going to have that need met.
We saw approximately 60 kids this first year, and we look forward to doing more this year because one of the biggest challenges was finding dentists to come do the project.
A third grade girl who has had a very transient life. She has moved from a situation where she's lived with a parent to living with a sibling. On the day that the dental clinic came and worked on this particular child, she ended up needing to have 6 teeth pulled. And to me, to have 6 teeth in your mouth that need to be removed, it just makes me emotional.
And once she was done, she got up and she just hugged the dentist and she was like, "Thank you so much for taking care of me." And she came back in even after lunch and she said, "Oh, I was able to eat and it didn't hurt as much as it's hurt for the last few times that I've had lunch." And she was hugging us and just thanking us, and she'd run through the halls and she'd show her teeth off, and it was just a great experience. And yet it was one of those reminders of how much this clinic is needed.
I want to get on the good foot. During the 12-week competition, I lost 64 pounds and 22% body fat.
The Lake Shores Health Challenge, we had written it into the grant as a media campaign for people to know their numbers, their cholesterol and blood pressure and so forth. But what it turned into was our version of The Biggest Loser TV show. And we called it the Lake Shores Health Challenge because we didn't want them to just lose weight, but also to exercise and eat right.
We had 10 fitness centers participate. Each fitness center had a team of 5 members competing. And then we also decided we wanted to open it up to the whole community for anyone who is interested in losing weight to participate.
They had resources available for them as far as dietitians, classes on health.
It was so much fun to work with the 5 people and see their changes and their attitude go from shoulders rounded, long faces, to standing up tall and walking with a little pride and knocking on my door I'm here again, I'm here again. It was very nice to see them change.
We ended up having over 300 people in our community involved in this health challenge, and it was great to have people get involved. It was great having the fitness centers all pull together, even though they're competing for business. They all came together and said this is important to improve people's health in our community.
I've encouraged everyone that I talk to, if they have health concerns or are interested in losing weight or just getting better shape, to take advantage of the health challenge.
You know, when you envision a grant and what it might do, you have a certain idea, but it's not really until it gets implemented and you hear the stories and the people's lives that are touched through it in a positive way that you realize, gee, all that hard work was worthwhile, and it certainly has been the case with us.
We're not a healthy country anymore, and we need to sort of have our eyes open and become aware that we're not eating right in this country. We're just not eating right anymore, particularly low-income people.
Well, we have some significant healthcare challenges. The first one is that a lot of people do not have full access to care because they can't afford it. We have about 16% of our population is uninsured, and another portion of our population is what we would call underinsured. Through this grant from ORHP, we have been able to do some things that would have been unthinkable in our community, even though they make a lot of sense. And the first foremost thing we've been able to do, thanks to this funding, is bring together the physician community, the mental health community, physical therapists, as well as people like me who are advocates and just interested citizens, and sit them together in a room and really review the research, think through the problems of health in our community and what we can do best to encourage people to be healthier.
I'd like to welcome everybody here today to the Healthy Living Advisory Board. Leah is going to give us a summary of where we are to date.
The goal program is improved the quality of our life because it's made us more aware of the amount of food that we eat.
And the quality.
I think the funding from the Rural Health Outreach Program has really been critical to get this off the ground, and hopefully it will create a self-sustaining attitude in this community that will promote better health. And like to see it go national, like to see it applied to other rural communities once, you know, we've done the pilot and worked out the bugs and, you know, really affect a change in the country.
124 or 76?
And I think this whole program brought into perspective with us that number one, we needed to stay as active as we possibly could, but the biggest thing was that we needed to eat nutritionally.
Mama may have, Papa may have, but God bless the child that's got his own will.
I think rural America holds some answers. They're not only a place where there's challenges and poverty and problems and issues, we all talk about that a lot. But let's remember, rural America is also where there's opportunity and hope and great communities and people with great ideas and the ability to make those ideas happen.
You know, these are 3-year grants, so after 3 years the money goes away, and so we're always looking for ways to sustain the impact. And I can say that even though we're only 1 year into our grant, we've already, because of this grant, been able to bring in $70,000 through 5 other smaller grants to extend or enhance the projects that we're doing through this grant. So we're on our way to sustainability already in our first year.
Those grants are venture capital. They're money to fund good ideas out in rural communities. But the idea is always that the community would eventually take that over and find a way to keep the project going. We're sort of giving them seed money for proof of concept.
Right now, whether we like it or not, our healthcare system is very much based on payment and financing. And so it's really important that we're able to make sure that rural providers and rural hospitals, doctors' offices, that kind of thing, are getting paid in a way that allows them to provide high-quality services.
ORHP has led in getting organized approaches in small hospitals to improving quality and building quality and reliability into care. We've kind of thought that all good things trickle down from Boston, and that by and by something good will happen down in the rural areas. Well, in this case, the rural movement to improve health care is make it more reliable, make it safer, is quite vigorous in rural America, and a lot of that credit goes to ORHP.
Happy anniversary to the Office of Rural Health. I hope you have 20 more years as successful as the first.
We appreciate your being there and supporting us.
And hope that you realize how much you are doing and what your funding is providing.
Happy anniversary, Federal Office of Rural Health.
Many happy returns, and keep up the good work.